Hello, and welcome to another UK column interview. My name is Debbie Evans, and as many of you know, I'm a retired state registered nurse. And today I am joined by another angel in human form who, as well as having to live with vaccine injury, is also the founder of the Scottish COVID-19 Vaccine Injury Group. And we've spoken to Charlotte many times at UKCV Family, but what is going on north of the border? And so today I'm so grateful to Ruth Raffa, who has agreed to join me. She is the founder of the group. Ruth, welcome to UK Column, and thank you so much for agreeing to talk to us.
Hello, Debbie. Thanks for having me. It's great to be here today.
Oh, Ruth, what a story you've got. Before you tell me about the group, because I know you've got a lot of people in the group in Scotland, but before you tell me about the group, tell me a little bit about you and how you found yourself in this position. Tell me your story.
I took my vaccines way back in 2021, Debbie, and became vaccine injured myself. After my second AstraZeneca in June 2021, I started experiencing anaphylaxis. It was idiopathic anaphylaxis, which meant there was no particular trigger. And then I started developing lots of neurological issues as well. So, I had the symptoms I had go on and on and on and on, and everybody who's vaccine injured have heard them all before. But it culminated in the end with me sometimes barely being able to hold conversations. I couldn't process people's words. I couldn't form sentences at times. All of these things were intermittent. And sometimes I even couldn't walk properly. I was veering off to the left. I was experiencing pain, tremors, all those usual things, skin burning, loss of bladder control, loss of temperature control. And of course, all peppered with these extreme allergic responses I was having. I tried to get help on the NHS, and my GP was, quite frankly, flummoxed and didn't know what on earth to do with me or where to send me. And I ended up at the anaphylaxis clinic. And they basically told me that this couldn't possibly be the vaccine and that I had to take a booster, and that perhaps this had all started because of the general anxiety from the lockdowns, and that it basically somehow my fault. We hear this quite often in the group. This is sort of form of gaslighting because they can't explain what's happening to us. They try to blame us. Basically, I was told that I had this condition called mast cell activation syndrome, which is your immune system overreacting, and it basically creates all these different chemicals that are designed to alarm your body, basically to tell you something's wrong. But there's no diagnosis or treatment for that on the NHS. So the anaphylaxis clinic took blood tests to prove that I didn't have allergies, because that's what they treat, allergies, so that they could actually discharge me. So that was the end of my help from the NHS. And I'd already formed a group by this point because I'd found out about the Scottish Public Inquiry. I'd been part of the UKCV family, and they're involved in the UK Public Inquiry. And I was doing a wee Google search to see if I could find any news about what was going on there. And I accidentally stumbled across the fact that there was a Scottish Public Inquiry, and thought, oh my goodness, we need to take part in this. And so that's why the Scottish group was formed. For that reason. And we do have co-participant status in the Scottish Inquiry and also in the UK Inquiry as well. So, and that was a bit of a garbled story, but here I am. I never, ever anticipated that I'd be doing this. So we have a support group through Facebook, and we have social meetups and all the usual things to try and provide support, because most of the people that join the group cannot get the help they need on the NHS. And so we're trying this, that, and the next thing, and we're sharing ideas. We're scouring the internet for any up-to-date information or research that could help. And that's really what the group's there for, Debbie.
you're talking about the group there, and we are going to come on and talk about the group in a lot greater depth, because I'm going to be asking you how many you've got in the group as well. But I just want to come back to you for a minute, Ruth, because we've spoken for many hours before, and you're always absolutely, your priority is the group. But I just want our viewers and listeners to know of some of the symptoms that you've had and how this has impacted your life, because you mentioned mast cell activation there. And I just want to read out a little bit of information about mast cell activation so that people who are watching that haven't heard about it know about it. But also, I want to tell people that the Scottish Vaccine Injury Group have got an amazing website. And on that website is all the information that you're going to need, including mast cell activation. But just for people watching, it's a relatively unknown condition, and it can affect people. You may have heard of POTS, postural tachycardia syndrome. POTS, you may have heard of it. Now, this is caused by abnormal mast cells or abnormal release of chemicals contained within them. Tachycardia means a fast pulse. So someone might feel their heart beating very fast, and it might be affected as they stand up or sit down. It's postural, so it depends on how your body is positioned. So what are mast cells, for example? Well, mast cells help fight infection, but they're constantly interacting with the environment around you. So this is why this is so important. And it's made a huge difference to your life, Ruth, I know, because it can cause severe inflammatory reactions. And you've been telling me that even petrol fumes, toothpaste, water, I mean, pretty much anything can trigger symptoms of allergy. And what happens is that when these mast cells are activated, they release too much histamine, don't they? And this creates symptoms. Now, not all mast cell activation is caused by POTS. There are other causes too, but it is relatively unknown. And Ruth, you've had great difficulty having, I mean, even one doctor, correct me if I'm wrong, please, but didn't somebody say, oh, you're going to have to try and calm your mast cells down?
Yes, that was the anaphylaxis clinic, the consultant there. And it did come out a bit of as an accusation, because basically, Debbie, there's no way you can calm your mast cells down yourself. Just to clarify, the mast cell activation syndrome and postural orthostatic tachycardia syndrome are both come under this umbrella of dysautonomia. Ehlers-Danlos syndromes also comes under that, and the three can be often connected. So you can have all three or a combination of any of them. So yes, I was told that I needed to go in, calm down my mast cells, but I knew by this point because a doctor who's a friend of mine who had long COVID said to me she'd heard of this condition of mast cell activation syndrome. And so I'd gone away and done lots of research and joined a support group. And I knew that I needed certain medications. There's a whole sort of selection, combination of different types of antihistamine that you need to deal with a histamine overload. But also you need mast cell stabilizers to actually calm down your mast cells. And hopefully, eventually, you'll be able to come off those medications. Some people are on them for life. So I knew I needed these medications, but I couldn't get them anywhere. And my GP didn't have the authority to be able to prescribe those. Only a consultant could. But the trouble is that there are no consultants on the NHS who specialize in this condition. So I was in a catch-22 situation there. I ended up, thankfully, I had a number of a private doctor who specializes in long COVID vaccine injury and in mast cell activation syndrome. He's part of the FLCCC group of doctors, frontline COVID critical care doctors, and they are amazing. And I paid to see this consultant who diagnosed the mast cell activation syndrome and gave me the medications I needed. And then my GP was able to prescribe them because a consultant had authorized their prescribing. Does that make sense? But the fact is that I had to go privately to do this, which is absolutely scandalous. So it really is my life's mission at the moment to make sure that mast cell activation syndrome and postural orthostatic tachycardia syndrome, that they get put on the map, because there's no way that we should have to wait a year or 2 or 3 or pay to see a private consultant when a GP or even a prescribing nurse could probably deal with these, because they're not hard to diagnose. The way they diagnose mast cell activation syndrome in the UK at the moment is basically to put you on the medications and see if they work. And if your history is pointing towards that, it's pretty obvious, because you usually get a combination of symptoms from lots of different body systems, because it affects your gastric system, your bladder, it can affect your cardiovascular system and your skin particularly. You get lots of itching and burning and inflammation. And you can get, all the usual signs of allergy, like itchy eyes and runny nose and that sort of thing. So it's pretty obvious. Oh, and it can affect your breathing. It affected my breathing quite badly. But the asthma clinic said, no, you don't have asthma, you have reactive asthma. So, if all these people knew about mast cell activation syndrome, it would make a huge difference. So anyway, that's enough about mast cell activation syndrome, probably. But the thing is, I know that loads of people who join our group have this. They start to share their symptoms. I get to know them and I go, you've got MCAS. You've got MCAS. But then it was like, well, what do we do with you? Because you don't have the money to go privately. We'll send you to your GP and they won't have heard of it. Where can we send you? There's nowhere. So it's a huge issue that we're lobbying to try and get overturned and sorted. And of course, people with mast cell activation syndrome have been trying to do this for years. So we're just joining their fight, really.
And I'm really glad you are, because it's a topic that isn't talked about, Ruth. And just to reiterate for people, because I do think it's really important. The symptoms are they span all sorts of things. Many common symptoms: nausea, vomiting, itching, like you've said, chills, eye swelling, breathlessness, headache, tingling, fatigue. And fibromyalgia, I see, was mentioned there too. So people that are suffering from fibromyalgia, pain all over the body, wheezing, blocked nose, tachycardia, fast heartbeat, fast pulse, variable blood pressure, diarrhea, abdominal cramps, constipation. I mean, the list goes on endlessly. And you experienced symptoms, and also antibiotics, we should say. You can get allergies to that too. So we should also say, I think, Ruth, that you suffered these symptoms very soon after you had an AstraZeneca injection, and you now have to carry an EpiPen.
Yes, Debbie. After my first AstraZeneca in March 2021, I had to get allergic reactions to food, like, baked beans and corn and things like that, things that I ate every day. And, just sort of general mouth swelling and mouth burning, that sort of thing. I thought, this is odd, but didn't really think anything of it. We were in the middle of COVID and I thought, okay, it's just a bit of an allergy. Don't make a fuss. Just get on with life. And then 2 weeks after my second, I was in the kitchen preparing a stew for the family that, I ate regularly, and I tasted the stew and it had paprika in it and olives. And then the next thing is that my throat started to swell and close. And my husband was at home, thankfully, because he's a first aider. And by the time I got to him, I didn't have a voice left because my voice went. That was a usual sign for me that I was about to go into anaphylaxis and my voice would go first. And he managed to get me to take an antihistamine, which is amazing because my swallowing was being affected too. I was choking. And he put me in the car and rushed me off to the hospital. It's just 10 minutes away, thankfully. But during that time, my breathing, my throat didn't closed completely, and it wasn't a full anaphylaxis. Thankfully, the antihistamine did kick in very quickly. But the chest pain I was experiencing, the faintness, these were all normal signs for me. So after that, as you said, I started to react to anything and everything. And for a long time, for a few weeks, all I could really eat was white rice, apples, and milk, because I'd worked out that they were things that I didn't actually react to. And from there, I had to gradually introduce things a bit at a time to see what I could actually eat or drink. And you do that over a period of days. You just try tiny little bits and then increase how much you eat and drink and see if you react or not. But I couldn't really cross the door because of fumes or people's aftershave or perfume or air conditioners, reed diffusers, anything with chemicals. I couldn't even use face cream, moisturizer. For a while, when I worked out, I could eat olive oil. I used olive oil to moisturize my skin. So it was quite a journey. So it was wonderful to find that doctor and get some treatment because it wasn't improving by itself. But yeah, as you said, on our website, I've put a page just dedicated to mast cell activation syndrome with links to lots of different websites. And there's low histamine food list because, of course, food has histamine in it as well. And different foods have different levels of histamine. So I now am on a histamine-free or low histamine diet. And I can't even yet eat foods with high histamine levels, so tomatoes, for example. But you can have a very rounded diet. So I can eat fruit and vegetables and meat and everything, but there's certain types you can eat and certain types you can't. So you just have to familiarize yourself with the lists. So it was a nightmare. I did feel like my whole world was ending. My husband actually ended up buying me this Oculus Quest headset so that I could go to the beach every day if I wanted to, because the beach is my safe place. And I used to, I would be reacting very badly to things going, I just want to be on the beach. So he got me a headset and I'd sit and I'd be on the beach as often as I wanted. So it's a horrible condition. And I know there's people out there who have it who don't know what it is. And they're going to see lots of different doctors, lots of different specialties, and they're all treating that part of the body. So the dermatologist will be treating the itching skin, and the gastro guy will be treating what they think might be irritable bowel. But it's actually mast cell activation syndrome under a lot of it. And if they could just treat the cause, then that would be the answer, the key for a lot of people.
I think the information that you're giving today, Ruth, is absolutely vital. And I know that a lot of people will be extremely interested, and hopefully will go straight to your website and have a look, because, after all that you've described, the doctors are still telling you, have another jab. I mean, it's not, oh, no, this is a serious adverse reaction, you mustn't have any more. No, they were trying to tell you to get more. And I know now, I know that you are absolutely desperate to the group. And I promise you, we will talk about the group, because I want to ask you, number one, two questions really in one question. Number one, how many members do you have? And what kind of symptoms are your members experiencing, Ruth?
Now, Debbie, we have roughly 650 members. It's hard to tell exactly because we have some people who join us in the Facebook group. So there's 600 in the Facebook group now. And we have others that have joined us in other ways because they don't do Facebook. So around 650. And what kind of symptoms they have? Well, there's a common theme. As we all know, the vaccines can cause myocarditis and blood clotting issues, which lead to strokes and heart attacks and cardiomyopathy. So we have a lot of people with these conditions, as well as people with dysautonomia. So that could be the postural orthostatic tachycardia syndrome or MCAS, and a lot of neurological issues as well. almost all of us have neurological issues to some degree. Now, that could be caused by mast cell activation syndrome, but it may be caused by brain inflammation or other neurological issues. We have people who've been diagnosed with multiple sclerosis and motor neuron disease. And then there's people with eyesight issues as well. Migraines with aura and things like that. So there's quite a variety, but the issue is that this spike protein gets everywhere and it causes so many issues. But there's websites that list thousands of peer-reviewed studies now linking the vaccine to conditions to do with every part of the body. So, I remember when the first person joined us who said that they had sudden onset rheumatoid arthritis. And I was slightly skeptical because I thought, we haven't really heard of that one before. But before long, we had loads. And these symptoms, happened immediately after the vaccine. But it took people quite a while to join the dots. So we still have people who have been unaware that it was the vaccine that caused their issues. And then they hear from us and they suddenly join the dots. Or we also have people who knew they were vaccine injured for up to 3 years now, but thought they were the only one. I know when I first realized that it was definitely the vaccine, in my case, it took me 6 months to find somebody else who was vaccine injured because there's so much censorship on social media. And that person was in America. And then it took me another 3 months to find the UKCV family group. So that was 9 months for me, 6 of those on my own, thinking I was the only one. And so many people share the same story when they join us. They say, I thought I was the only one. And they have this joy of finding other people that can understand where they're coming from, because a lot of people just don't get it. I think anybody with chronic illness really needs other people with the same illness to identify with and to form friendships with. But with the vaccine damage, particularly so, because there's so much stigma surrounding the vaccines.
I think it's incredibly important. In fact, I think it's vital. It's life-saving, the work that you're doing, Ruth, because people need to talk to one another. But more than that, I think the common theme I see running through those with vaccine injuries, no matter where they are in the world, is the difficulty and the frustration that they're not being listened to and they're not being believed. And so many of your conditions and your physical symptoms, let's talk anaphylaxis, to be told that this is brought on by anxiety. This is what we're hearing more and more. So the fact that your groups are there, I know, are saving lives, because talking to other people that are going through the same is just incredibly reassuring. And I just want everyone to know that the links to Ruth's website and the group's website and the donate page, which we'll come on to a bit later, are all going to be in the article beneath this interview. Ruth, I've heard from many people, and we hear it all the time, long COVID. And I've spoken to many experts, including Professor Chris Flowers, who has come up with the term spike protein disease. And I want to ask you, with your members, what is the difference, if there is a difference, between long COVID, and I say that in inverted commas, vaccine injuries?
It's quite a controversial question, and different people have different views. We do have medics in our group who had post-viral or long COVID symptoms before they had a vaccine, and then recovered and then went and got a vaccine and got vaccine injured. I think that spike protein, wherever it comes from, is such a nasty, nasty thing. And we now know, don't we, there's research that shows that it crosses the blood-brain barrier, that the mRNA vaccines didn't stay in the arm, the lipid nanoparticles travel throughout the body. So we, some of us feel like we're little spike protein producing factories. And in fact, an Italian research study that was conducted months and months, I think it was about a year ago, found that spike protein was still persisting in the bloodstream 6 months after the vaccine in some vaccine candidates. So that research was stopped due to lack of funding. So we don't know how long people still have spike protein in their blood. And of course, your blood goes everywhere, doesn't it? So this spike protein is shredding vascular systems. It's causing inflammation. It's doing causing all sorts of disease. So what's the difference between long COVID and vaccine injury? I think that we won't know until there's more research, but we certainly know that spike persistence in vaccine injury is a big deal. And until they test people to find out how long this spike stays in the bloodstream in long COVID and in vaccine injury, we don't know. And how many people have been told that they have long COVID when they have a vaccine injury? And the thing is, even the clinical trials were unblinded, weren't they? And people were then given the vaccine very quickly. So we still don't even have any long-term data on the comparison between the people who had the vaccine and people who didn't. So it's all very complicated.
The point that you brought up, which is extremely valid, is that until we have the data, until we have the investigation, until we have a trial, until we have results, we are never going to know, are we, whether these long COVID cases are actually masking vaccine injuries. And that's where we need an investigation. And again, until we eliminate that, we have to still have that on the table, right?
I think the big difference between long COVID and vaccine injury is that there's a huge stigma associated with vaccine injury that there isn't with long COVID. We had this whole culture built up, this culture of fear that COVID was the thing that was going to kill everyone and we were going to kill our grannies and we had to have the vaccine. The vaccine was going to save everyone. We had Nicola Sturgeon in the Scottish Parliament saying that anyone who refused the vaccine was not only irresponsible, but selfish. And we had Tony Blair saying the vaccine was the only way we were going to get out of lockdown. So all this fear was built up with the daily deaths from COVID and the amount of people who died from COVID being announced over and over every day, and the vaccines were going to save us all. And so, of course, the minute you say that you think that you're vaccine injured, well, it's like you've sworn at somebody. It's like you've blasphemed. And many of us faced extreme disbelief from friends, and some people have lost their friendships. Some people have even lost their life partners because of this. It's a big thing. It's a huge stigma. So long COVID is awful. And the symptoms that people who say they have long COVID suffer often overlap with the symptoms that people with vaccine injury suffer. And as you said, Debbie, we don't know how long they're going to last. We don't know how to treat them. We need research. And we don't know how many people have been told by medics that they have long COVID when they have vaccine injury. And in fact, some vaccine injured even don't mention the vaccine. They just allow the doctors to go ahead and think it's long COVID because it's the only way they're going to get treatment. We've had people turned away from long COVID specialists who were going to give people the treatment that they needed, but they've been told, no, you don't have long COVID, therefore we can't treat you.
Wow. So what you're saying then, and is basically, don't mention the vaccine. Even if in your case that you knew it was the vaccine because you had such a rapid effect after that injection, and what else had changed in your life? Nothing apart from that. So you are being censored, and we've heard this as well from UKCV family and from Charlotte, where the vaccine injured are scared. They're scared to speak up, and they're having to, what's the word I'm looking for that could possibly humour their doctors to go along with whatever their doctors are saying, just in order to get some form of relief. And so the fact that you're all being censored you're scared. You mustn't mention vaccine injury. Otherwise, you might get nothing. You might just get a prescription for an antidepressant or a referral to the men's team, perhaps. This is the kind of life that you and those that are vaccine injured are actually living. And coming on to all of your members and, given all of this that you're going through, Ruth, what problems, I mean, as if those weren't bad enough, but what problems and hurdles are your members finding when they're trying to get help and trying to get some treatment?
Well, as I said, Debbie, often they first of all, they have to make the decision, are they going to mention the vaccine or not when they go to see specialists? And often this is a question we see on the group a lot, people, new members saying, I've got an appointment with a neurologist. I've waited 2 years. Shall I mention the vaccine or not? And our advice is actually, maybe at the start, don't. Just see if they ask the question. See if they ask you, when did this start? See if they ask you, was there any changes in your life when this started? And try and just feel things as, just go with your gut. It's awful, absolutely awful, because the people are made to feel shame for being vaccine injured. Just feel shame because you've gone out and you've done the right thing, and you end up with your life turned upside down. You can't look after your children and you can't work. And in fact, sometimes you can't even get out your bed. It is appalling. And the fact is that doctors should be expecting this. This is a novel vaccine rolled out very quickly on a massive scale. Every medication has side effects, and these ones particularly so because they're a new technology. I mean, the mRNA and vector viral vaccines have never been used in this kind of application or on this kind of scale. And we had no idea what it was we were taking. We thought it was standard old-fashioned vaccines, a bit of dead virus put into your bloodstream. We had no idea. And the doctors also, did they have any idea? Have any of them actually read up about this? I don't know. So we get some doctors who are actually very sympathetic and will actually even go so far as to write it in our medical notes. But they're very few and far between, because most doctors who will acknowledge it's the vaccine won't write it down because they're scared to. And a lot of them will just say, don't be ridiculous, it can't be the vaccine. And you find that the level of care and your credibility is suddenly undermined with them. And the way they treat you changes. It's really disgusting, to be honest. We had one group member whose GP was very on board the fact that the vaccine was causing all her issues 1 week. And then when she went back the following week for her follow-up appointment, he had changed completely. And in fact, he said to her that if she didn't stop talking about the vaccines, that he'd have her struck off the NHS, which isn't even something you can do. So we have to wonder what kind of message has been sent out to him in between times. Has he shared what's happened with his colleagues, or did a letter come out? We don't know. So when you're ill and already suffering so much trauma and so much stress, the last thing you need is to feel like you can't be honest with your doctor.
Well, I've made quite a few notes. There's quite a lot to unpack there, Ruth. And I think you did what the government told you to do. You trusted the government. You trusted the science. You followed the science. You did what you were told to do. And somebody's saying you're going to be struck off the NHS. I mean, I had to let that sink in for a minute, because that is fear-inducing for many people. For others, they would probably be very happy to be struck off the NHS. Sadly, it's not possible to opt out or be struck off the NHS. So if anybody else out there is worrying now that they could end up abandoned and struck off, there is no way of striking you off the NHS. Once you're in the NHS, I'm afraid there is no mechanism to opt out. So we are all at the behest of the NHS. Should anything happen to us while we're outside, we'll get scooped up by the NHS. So That is an absolutely despicable thing to say. You asked about doctors and why didn't surely doctors know. I wrote a letter to the Royal College of General Practitioners to ask exactly that question, because that comes down to informed consent, doesn't it? And of course, nobody got a patient information leaflet prior to the injection, and you didn't get a list of ingredients after the injection either. So I wrote to the Royal College of General Practitioners to ask what the ingredients were of why, if doctors knew the ingredients, why weren't they telling you? And also, why weren't talking to patients of serious adverse reactions? And the response I received was quite shocking, actually, from the president of the RCGP. And he said doctors didn't know the ingredients of the injection, and they also weren't informed of the adverse reactions. So they couldn't have informed you about anything, which begs the question of why did they give something when they didn't know what they were giving? But that's for perhaps another time. I want to get on to a little bit more positive, a little bit more of a positive frame now, in that tell us what you're doing and how you've got the word out, because the word is out about your group and more people, sadly, are joining. But in another way, I'm really, really happy that they're finding you and they're finding other people that they can speak to. But what's the group doing at the moment? How are you spreading the word?
Well, there's lots of different ways. We've got leaflets. We've got people giving out leaflets on our behalf. Wonderful people who aren't even vaccine injured, which is just great. Last year we had a rally. John Watt organised that. It was fantastic. And in fact, we had people who heard us. Well, there's one particular woman who was in a railway station on her way home. It was her first ever weekend away from home. She had a friend with her. She was on her crutches. And she heard us from the railway station and came and missed her train, actually, but joined the group. So we're trying everywhere we can through social media, through interviews like this. We're campaigning and lobbying MPs and MSPs. Just any way you'd expect, Debbie, we're trying it, but we are finding the censorship difficult. It is, we can get the word, we can spread the word, for example, through Twitter. The kind of people who follow us are the kind of people who support us. So we're not actually reaching people who are outside of our little bubble. So it's really difficult to break through, but word of mouth is the most powerful thing. Friends of friends and that kind of thing. But the censorship is, as you say, is unbelievable. Even our website was blocked by an organization called Whalebone. I changed internet provider and for some reason couldn't access our website anymore. Spent a whole day with our website hosting service, and they did all the checks to make sure there was no malware, there was no spammers or phishing people trying to hook onto our website. Everything was clean. It was squeaky clean. And it turned out it was our internet provider used this organization called Whalebone. And they basically said this warning came up every time I tried to get into our website, saying that it was going to steal my personal information. And it was a dangerous website with misinformation in it. Oh, great. So I had to I took a week to try and get that one sorted out. Honestly, it's unbelievable. But word of mouth, family members, friends of friends, that kind of thing.
And Ruth, I have to tell everybody that we had a long conversation, as I've said before. And I was quite shocked to realize that up until now, and we're 3 years down the line, up until now, you've been paying out for all of this yourself, because there are expenses, right? You're printing flyers, you're spending a lot of time, you're sending letters, you're producing petitions, you're using transport to go to all sorts of meetings, and we'll come on to the Scottish Inquiry at the moment. And you never had a donate page or were fundraising in any way. And I'm very glad to see that just in the last couple of days, you've put a donate page up to help you with the running, the everyday expenses of leaflets and things. And we're going to put that link up on the page as well. And if anybody would like to donate, then I know it will be going to a very good cause. Let's talk, though, about something a little bit sadder, in that in your group also, like the group in England and Wales, you have a bereaved group as well. And we mustn't forget the people that have been bereaved. Ruth, can you give us any updates on how people are up there and how many people you're finding now joining the group because of bereavement?
Yeah, Debbie, I'm always really, really moved by the vaccine injury stories, particularly the young people in their 20s who can't live a normal life anymore. But the bereaved stories are always the ones that end up, moving me to tears because they are so, so tragic. Percentage-wise, at the moment, we don't have a large percentage of bereaved people. I actually need to go and look at the statistics and work out precisely how many, but maybe 30%, 20-30%. And I think they're very brave joining our group, actually, because the majority are vaccine injured. But the stories, Debbie, are so, so, so traumatic. People who've died horribly at home. Some in the early days during lockdown, and even some more recently. And I mean, somebody sent me a message about somebody who joined the group, and their family member died at home in the house with their children there, from horrible blood clots and hemorrhaging. And it's just, people, a lot of bereaved people, I honestly think, don't need to be being bereaved. If vaccine injury was expected, and if people knew about all the side effects from the vaccines and were looking for them, those deaths could have been prevented. And we have people in the group whose elderly relatives died at home because they were too scared, because it was during lockdown and they'd had their vaccine and they were reacting, they were paralyzed or they were having chest pain and they were too scared to go to A&E or to ring a doctor, and they were being brave because, they're doing their bit, a bit like during the Second World War, dig for Britain, do your bit. I'm going to be brave. I'm going to stay at home. I'm not going to burden the NHS. And they died at home. It's just horrible. And the thing that I really feel for these people is that they can't move on. The Scottish Bereaved Group gave testimony in the Scottish Public Inquiry, and they said that people who lost relatives to COVID during the lockdown, it was a bit like people who've lost relatives to murder or violent death, that there was this additional trauma that had been added, and this was all discovered through research. There was research studies done. And I think about the people who've lost their loved ones to the vaccine. And I think the same absolutely applies to them, because they cannot move on. They can't get closure because they can't get recognition that it was the vaccine that killed their loved one. And they know it was. And they face the same stigma that we do when they say that they think it's the vaccine. So they can't talk to anyone about it. They can't offload, they can't grieve. And we need closure for these people. It's really important.
Well, I'm just so glad that they've got your hands to hold, because without you and without groups like yours, I guess you'd all be forgotten, because I believe that the numbers of vaccine injuries are very much higher than we even dare to think about. And in England, of course, we're having the COVID inquiry, Baroness Hallett, which is going to go on for, I don't know how many years, probably another 4 or 5 years. We've been told that it's going to be put on hold at the vaccine injured module, because the English inquiry goes in modules. That's been put on hold. But of course, north of the border, Ruth, you've got your own Scottish COVID inquiry, and you have you've really fought hard to become core participants in the inquiry. So for people that aren't aware of what's going on in Scotland and aren't aware of the differences in the systems, give us a little bit of background and how you're involved with the Scottish COVID inquiry.
Okay, well, the two inquiries are running in parallel, and the idea is that they don't overlap. So the Scottish inquiry is looking at anything that is devolved. For example, the healthcare provision or the social care provision here in Scotland, and education in Scotland, and decision making that the Scottish government have made. And the English or the UK inquiry is going to look at issues that were centralised, like regulation, vaccine safety, and they'll be looking at healthcare provision in England. So the Scottish inquiry is doing things slightly differently because they're, instead of just going through each module one at a time, each subject matter one at a time, they're doing it in layers. So they've got 4 main areas that they're covering. I can't remember what they are. I mean, I know there's health and social care, there's education, there's business, and I can't remember what the other one was, to be honest, I'm sorry. But they're going to, first of all, look at how all of these areas were impacted by decisions that were made. Then they're going to look at how the decisions that were made were actually rolled out. Then they're going to look at the decisions themselves. So they're moving backwards because they decided that they needed to see how all those decisions impacted real people to give context, then to look at how they were rolled out and why they were made. So they're moving backwards, so they'll be doing that for health and social care. First of all, they're looking at impact for health and social care. Then they're looking at impact for education. Then they're looking at impact for business. Then they're going to look at how the decisions were rolled out for health and social care, for education, for business. And then they're going to look at the actual decisions that were made for health and social care and business and education. Well, that makes sense. So this is going to go on for quite some time as well. But I'm actually so far really encouraged by the openness of the Scottish inquiry. They're really taking their time to listen to people. They're not limiting people in what they can share. They're not censoring what's said. And some of the stuff is actually very shocking. And what we're hearing about deaths in care homes at the moment, about midazolam deaths, about how everybody in care homes were labelled as having COVID when they didn't. They just, any sickness they would just put down as COVID. There's lots of things coming out in the inquiry. So I'm very hopeful that we'll have a good hearing in the Scottish inquiry. The UK inquiry are the ones, though, that are going to be looking at the safety of the vaccines. We're not discussing that in the Scottish inquiry. We're just looking at the healthcare that we've received.
In your dreams, if you were given a wish, what would you wish to come out of the Scottish inquiry?
So much. So much. I mean, we have a list of things that we desperately as a group want to see happen. For example, in the future, if this ever happens again, we can't have a situation where postmortems aren't conducted, where there are no fatal accident inquiries. The amount of people that have probably died from these vaccines and there's been no acknowledgement of it. Their deaths were just brushed under the carpet. That's one example. We've discussed MCAS, mast cell activation syndrome, and the lack of awareness. We need this to be recognised and treated on the NHS urgently. So urgently. In America, they reckon 17% of the population have MCAS, and it's widely treated there. So if that is translated to our population, how many people are sick and struggling and just not getting the treatment they need? That's something else we want to come out. The fact that doctors have been so afraid to acknowledge vaccine injury, that's something we want to come out. I've written a whole list. Let me have a look. Oh, yes, the big one, that the regulatory process be looked at. There's been so many issues, and Debbie, I know you've spoken about this in so many of your programs. But why? Why were these regulated so quickly? Why? Why weren't we told that they were still in clinical trials when we took them? And then there's a whole issue with the Pfizer, what they call the Pfizer switch and bait, where we've discovered the actual Pfizer vaccine that was used in the clinical trials is not the same as the one that was mass manufactured. And the MHRA knew that, and they still haven't seen the results from the clinical trials of the individual participants who were given the second manufacturing process. They've admitted to that. We've seen it in a Freedom of Information. Why is that not in mainstream media? Why isn't that in the BBC? They say it's the same product. It's not. It's made in a completely different way. So this regulatory process has to be looked at. The MHRA get 86% of their funding from Big Pharma. So the regulators, who are the gatekeepers, who are protecting us, get their funding from the very people that they're supposed to be regulating. There's something wrong there. So it really needs looking at, and everybody's affected by this, not just vaccine injured. Every medicine, every vaccine goes through those gatekeepers, and this really needs looked at. So this is something that we strongly, as you can see by my wording and by my expression, strongly want looked at in this inquiry, and the safety of the vaccines as well.
Ruth, you
People
are a woman after my own heart. You really are, because when you say those letters MHRA, I feel every single hair just on end. And you're absolutely right. They're not a regulator. It's a revolving door enabler. They enable the pharmaceutical Big Pharma to supply you with what you've had. They're enablers, and they say they're enablers, but we won't get on to the MHRA because, as you well know, the UK column we've had our foot on the accelerator with the MHRA for 3 years now, and I've attended every single board meeting, and Dame June Rain and Dr. Alison Cave know exactly who UK column are, and we won't ever stop. I can feel, I know how you feel, I really do, Ruth, because you're absolutely right. And as for the Pfizer, the bait and switch and the process 2, if anybody wants to know a little bit more about that, then we have done an in-depth interview with Professor Chris Flowers. It's on the website. It's called A Bunch of Flowers for Pfizer, where he tells you all about the process 1 and process 2, which is exactly what Ruth has just been mentioning. So my final question to you, Ruth, before we go to a little bit of video, which we'll come to in a minute, but my final question to you is, what can the public do? People are sitting watching this now, many in Scotland. What can they do, and what would you like them to do?
Well, so much. First of all, I want to say thank you to everyone who supported us in the past. There's people who never took these vaccines. They knew what we didn't know, and they've not pointed a finger at us. They've supported us, and I'm so, so grateful to you. You said earlier, actually, Debbie, about the money. We actually were given some money at our rally. Most of it, all of it, the largest proportion of it went towards treatment for vaccine injured people, but we did use a small amount of it for leaflets. So we did have money for those. So what can you do? There's lots of things you can do. You can keep pressurising your MPs and MSPs, just like we are, about the MHRA, about the regulatory process, because this affects you. We do have a petition that we submitted to the Scottish Parliament for them to recognise and treat vaccine injury. That was submitted by one of our group members, Billy McQueen. Now, I've put a link to that on the front page of our website. If you could please sign that, that would be wonderful. If you can spare some money, that would be fantastic. I have not set a high target for our Just Giving because our admin costs aren't that high, but it would be good to have some money to pay for our website. Because as Debbie said, I've been paying for that myself, but other group members have paid for things themselves too. Any money that we get over and above what we need for admin will go towards a charity that we're setting up to pay for treatments for the vaccine injured. We find the things that work for us are the therapies that we can't get on the NHS. Things like hyperbaric oxygen treatment and PEM and infrared and near red light therapy. All these things cost a lot of money. So we want to have our own bank of these that group members can have access to. Sign our petition, donate a small amount of money, keep writing to your MPs, and keep lobbying for research for us into vaccine injury, please. Until we have the research, we don't really know what treatments will work and what won't. We need to know if we still have high levels of spike protein. And most of all, we need research to validate the treatments that doctors will give. We've heard of somebody who was turned away from treatment by a consultant because the consultant said that the treatment would be experimental because this is a new novel condition. So there was nothing to say that the treatment would actually work or not. But this was, if this person's symptoms hadn't been caused by the vaccine, they would have got that treatment. So we need research. So please spread the word as well. If you know anyone who's vaccine injured and they live in Scotland, tell them to join us. There's UKCV Family as well, which is a wonderful, wonderful support group. They're UK wide. Send them, signpost them, share the word, spread the word. Recruit people. As Debbie said, we know that the yellow card reports are something like 485,000. reports of adverse events to vaccines, and we only have 650 in our group. There must be thousands in Scotland, and we're wondering where they all are and have they heard of us? And we want them to at least have the choice to join the group. So please keep spreading the word.
And we will certainly keep spreading the word too. And before I throw to you for the last word, as we always do, Ruth, I know you very kindly sent us in some video of some of your members. And we're going to play that now before we come to your last word. So let's take a look at the video.
My name's Anya, I'm 25 and I'm from Edinburgh. I took my second Moderna COVID vaccine in September 2021. And after this, my entire life changed. I had swelling starting in my hands and my wrists and my feet. Severe inflammation, which then spread throughout my whole entire body. I went straight to the GP and they quoted me a 12-month wait to be seen by rheumatology on the NHS. After they looked at my inflammation markers, they told me not to wait and to go private. I got myself into a lot of debt and I went private because I genuinely felt like I was dying. I couldn't move and I couldn't walk. I couldn't do anything for myself. I went private and they diagnosed me with seropositive inflammatory rheumatoid arthritis, and they told me it was a very severe case of it. The doctor was very confused as how fast it came on, with no history of it in my family. I had erosions in my bones and joint deformities over the space of 6 weeks after my vaccine. They told me I had to get a third COVID vaccine to get better, as I had to be fully vaccinated at the time, along with my pneumonia jab. I paid a lot of money to see this doctor. I trusted him and I went to get my COVID third booster. After this, my body was 20 times worse. I didn't even know if that was possible, but it was 20 times worse. I really couldn't walk and I really couldn't move. I was on steroids, morphine, tramadol, loads of anti-inflammatories, DMARDs, biological drugs, infusions. I needed a steroid injection into every single joint, which was £250 each, or £400 to £500, ultrasound guided. I had to pay this. I had no choice. I was living on my own and I had a mortgage to pay. I was in a cost of living crisis, and this was the last thing that I thought that would happen to me, just because I'd done the right thing. So I paid a lot of money to continue to see the doctor on privately. I eventually got into the NHS, and they put me even on more drugs. I've tried every DMARD possible, a range of biological drugs. Nothing. I wasn't getting better. I wasn't responding to these. I'm 25. I'm fit. I'm healthy. I was not responding to anything that was prescribed for classical rheumatoid arthritis. Eventually, I got to see a private doctor after my family had to help me out. We were very worried at this time. The private doctor confirmed this was a vaccine injury, and he's seen many cases like mine. He had to put me on a range of supplements and other drugs that are not licensed in the UK. I had to pay for all of these. Again, myself, to this day, I am still paying for all of these supplements just to try and get better. And when I went back to Spire one time to see another doctor, they confirmed it possibly could be due to the vaccine. Now, the gaslighting at the beginning of this whole situation is what got me into this situation even worse. I didn't need to get my booster. I'm really disappointed that the doctors and the nurses are so uneducated and they just don't understand this. This is a whole other pandemic on its own. I've had no financial help to this day, not one penny. I have spent thousands just to try and survive, just to try and get a little bit better. Even just now, I can't go a day without harsh painkillers, dihydrocodeine, cocodamol, naproxen, morphine, tramadol. I shouldn't have to do this at this age. I had a future and I had a plan, and just because I'd done the right thing, I can't even get up in the morning. I can't shower myself. I don't know what the future holds in terms of work. I'm keeping my house. There's only so much my family can help me out. I just hope that, and I deserve that, some sort of recognition and acknowledgement and some compensation for everything that I've been through, along with many others.
My father died 7 days after a second inoculation from the experimental CV19 therapy from AstraZ. I will abbreviate because of censorship reasons. My father was terrified to go out of the house. He didn't go out for a whole year. He went out twice. He went once for a flu jab. Second time he went out for a first AZ jab. And when he got his second, when the nurse turned up to the house, and unannounced, he had to be woken from bed. She jabbed him and off she went. There was no questions, no 15-minute wait as in the jab centres. There was no card, there was no batch number left. She jabbed and she left. Dad lost the use of his legs. He became disorientated. He couldn't get off the couch. He lay on that couch for 7 days. He couldn't get upstairs to bed. He gradually stopped eating until he had that massive heart attack in front of my mother and my sister. Now, my sister still has PSTD to this day. They had to do CPR on this man who's not a statistic, this man who's not collateral damage. This was a father, a granda, an uncle, a good friend to many. Because of travel restrictions, I couldn't get to my father's funeral. I live in France. Isolation restrictions. Test restrictions. We had to wait a month for the autopsy because we had signalled to the ambulance team that he had been inoculated just 7 days before. My questions, I have so many questions as our bereaved people do have, because there are many of us who are bereaved in exactly the same way. Why did the British government not pull this particular AZ jab off of the market, out of circulation, like the European government did, the European Union, did in March 21? Why did the British government not wait? Why did they wait until June 2021? How How did our pathologists in our corners come to a decision that these people who died shortly after these injections did not die because of these injections? What competence did they have with seeing death after this new injection, which has never been injected into people, never in the history of mankind? How could they possibly correctly diagnose the cause of death? We need answers.
Ruth, thank you so much for sending that in. And thank you so much for agreeing to talk to us. And I hope all of you in Scotland and around the country and around the world will support everything that everyone is doing. Please write to your MP. Please support your MSP, your MP. Please make a noise. We must not let the vaccine injured be forgotten. Ruth, thank you. And over to you for your last word.
I just want to use my last word to say thank you to UK Column for all the work you're doing. It's phenomenal. For all the other vaccine support groups out there, for all the people like me who have been, and our group members who are advocating for vaccine injured, and people who've also experienced other injuries from other medications and things like that. We know a whole new world has opened up to us that we didn't know existed before. So thank you for your support. And if you are vaccine injured and you're listening to this and you didn't know that groups existed, please join a group. That's where you're going to find out about the latest treatments that are working. That's where you're going to find people who really understand what you're going through. And if you are somebody in influence in the NHS or you're a politician, please, will you push for research for vaccine injury? Please, will you make sure that this never happens again? Vaccine injury doesn't discriminate. You can be rich or poor, old or young. A mother or a father or a grandfather or a child or a brother or a sister, it doesn't matter who you are, what your social status is. If you get vaccine injured, it can permanently disable you. It's really important that we get this word out and that we get the treatment to the people that really need it. Thank you.